Hi, my name is Dr. Stephanie Idjadi, Clinical Director of Reddy Care's Great Neck Location. Here today with Joy, one of our technicians. We're going to show you this cool piece of technology we have. It's called the TecnoBody Balance machine. So this surface right here, it's static right now, but if you press a button on the screen, it becomes dynamic, which means it's moving in different directions while you stand on it. The purpose of this machine is to work on patients' balance and proprioception. There are different games on here that we could play with our patients, different tests where we could check the duration of single leg balance or double leg balance, double stance support, eyes open, eyes closed. It's a great tool for geriatric patients and athletes. Obviously, the benefits for the geriatric population, it's very clear. They're going on it to work on balance, but for the athletic population, it's a great piece of equipment because after an ankle sprain or an ACL tear, meniscus tear, you lose the proprioceptive feedback in the lower extremity. So you need to work on balance to help regain that proprioception. There's also a lot of instability in single leg stance, especially with high ankle sprains. So this is one of the tools that we use to work on regaining the balance. Obviously, for a younger athletic population, we may be doing more single leg stance, while for our geriatric population, it's double stance support on a dynamic surface. Sometimes, if they're very advanced, we'll progress them to single leg stance with like contact guard or close supervision to make sure they don't fall. We have the handlebars on both sides, which is great, so the patient could also grab on if they feel unsteady. But I'm going to show you a few of the different things that we have on the screen, and different games and different tests that we do to just get more information about our patient. Every game and every test that is done, at the end there's a numerical value. So let's say they're playing Fruit Ninja, and you want to know how they did on that and how they're progressing the next visit. It'll give you their actual score on the game. So the goal is obviously just to progress them forward and improve on the scores. Same goes with the tests as well. So as you can see, I'm going to press the dynamic button over here and let go of your hands if you don't mind. And you can see down there it's becoming a little wiggly. I could actually move it a little, but it's not a stable surface anymore. So that's where the challenge comes in. And Joy, you can hold on, but try to stand on one leg. Bring your leg right in the center. And let go. You can see it gets a bit challenging. So this is what we usually do with our athletes, and we usually have them ski on there and trace lines in different games, which is pretty challenging on single leg. So let's go back to double leg support. Good. Okay. So in the games, as I mentioned, we have Fruit Ninja, we have skiing, we can fly a plane, go into the shooting range. Our patients' favorites are usually the Fruit Ninja and the skiing. We're going to try skiing. And there are different levels for all the games. So you don't need to start off giving your patient like a super hard game. So we're going to do this one. Basically, as I don't know if you ever skied before, you want to put your weight forward, lean forward, and try not to let it hold on. You want to work your balance there. Go side to side, don't go into the walls. There you go. Lean forward to propel forward. How does that feel?
It's a little hard.
Yeah, it's
harder than it looks.
Our patients love this. It sometimes gets monotonous doing balance in the clinic, putting them on the RX foam and just telling them catch a ball, throw a ball. Like, this is a fun way to convince them to do balance. And sometimes they forget about the fear that they have about falling when they're doing something like this because they think of it as a game. So, sorry, I'm going to close this off. We also have Fruit Ninja, so with this is probably the second favorite game. We'll do the hard one for this. So this works on support going from the left to right leg. The purpose is to cut the fruit, don't hit the bomb. This is like a popular game people play on their phones. So just getting them to move laterally like that. And this is good for patients that maybe had like a right hip replacement or right knee replacement. Getting them to get used to bearing weight on that leg by going side to side. All right. Okay, and some of our tests here, if you want to come forward, there's balance on both feet, eyes open, eyes closed, single leg balance. They want to see how you're doing with proprioceptive, testing, sequencing. So there are different tests that we do there to see how the patient's progressing. So a patient comes in for their first visit and we'll do these tests. Progress eval 10 visits in, we'll do these tests again. Discharge eval, we'll do these tests again, and we'll see how the patient's getting better in terms of their balance. And again, it's at all different levels. Balance on both feet, balance on single leg. You can switch it up based on the patient's functional level. And then there's different trainings. So this is actually pretty hard. It's harder than it looks, honestly. So you could do different kinds of lines. The length of the line, you could extend it to make it more challenging for the patient. This is, as I said, great for post-op hip, post-op knee. You can really make them bear weight on that leg by leaning all the way over to the right leg, trying to hit that dot. You'll see what I mean soon. You could also do angles like that. So let's play that one. So let go. You're going to be the plus mark right there. The purpose is to hit the yellow circle.
Follow the straight line.
Yeah. And go back. So you could do this in different planes of movement. So some patients might have limited base of support or might lose their balance when they lean forward or lean back or lean in different angles. So you could do circles with this, side to side, forward, back. So this challenges all planes and bases of support, which is great, and it's actually pretty hard. And this is one of the medium levels. I could make this a little harder for Joy, actually. How does that feel?
It's pretty challenging, actually.
Yeah, it's tough. So as I mentioned, I could do a circle as well. So this is probably the hardest one. And it really challenges you to go out of your base of support. So when she's leaning forward, it's not too easy getting to that, right?
Yeah, no.
So she'll probably have to use her step strategy to get to the next circle, but I mean, she's young. But for our geriatric population, this isn't so easy. So that's a summary of what we do with the TecnoBody. If you want to give it a try or have any questions, give us a call, 516-829-0030. Thank you.